This is Barnestorm training for the task of viewing patient information. In this session, we will review the patient information screen. To get started, let's select a patient by entering in the last name or the chart number of the patient. If you look up at the top of the screen here, you can see that the patient has been selected, and this is a good way to indicate that you have selected the correct patient. After the patient is selected, you want to go ahead and click on the Patient Information button located on the main menu, and this is going to bring up the patient information screen. This screen allows you to get a quick glimpse of the patient status and history. The first tab on the screen is Patient Information. This includes contact information, dates associated with the patient, demographics for the patient, the doctor and his phone number, who it was referred by, any allergies, DNR code status, any living will, emergency contact information. If you scroll down, you can get some more information about the patient, diagnosis codes, the patient had any surgeries, and if you keep scrolling down, it will also show you directions to the patient's house. The directions listed were generated at the time of the referral and should show directions from the agency's address to the patient's address. If the directions listed are wrong, or if you would like to add more detail, you will have a chance to edit them within the visit note. This patient information screen also lists the payer source, any medical history, and any miscellaneous notes that have been put in the patient's notes section. If you are connected to the internet while looking at this screen, you can use the map button that is located at the top of the screen here, and if you click on it, it will bring you to the internet, and it will open up MapQuest. And this will show you directions on how to get to the patient's home from the office. It will give you a map from point A to point B. If you have more than one patient you are going to visit, you can look at a full list of your driving directions in the schedule screen as well. But if you just need a MapQuest from your agency to the patient's address, you can get that here. The next tab on the screen is the ICD history. It shows the diagnosis codes for the patient. Most patients will have more than one date listed under ICD history. This allows you to see what diagnosis codes were set up for specific dates listed, just by clicking on the date. To go back and forth, you can simply click anywhere on the screen and it will take you back to the date list. This represents the patient's conditions over time. The next tab is the medication screen. And the medication tab shows the full list of the medication history. So there may be more than one listing for a medication because the dosage changes over time. To see just the current medications, you can click on the current meds only. If you click on one of the medications, it will bring you to this screen and show you all the information about this medication, such as the functional class, side effects, interactions, lab tests, nursing considerations, patient instructions, cautions. And to get back to the list of medications, just click on the screen. If surgeries are listed for the patient, they will be shown under the Surgeries tab. If the patient has any facility stays listed in the system, you will find them under the Facilities tab. And if the patient has any immunizations, those will be listed under the Immunizations tab. Our next tab is the Patient Progress tab. And this lets you see information in chart form. So you can click on the arrow where it says select a chart, and you can choose from temperature, pulse, respiration, weight, blood pressure, pain, and so on. So let's go ahead and click on temperature. And then you can choose the dates of when you want to see the progress for the temperature. So let's go ahead and click on some dates, and you just click on the arrow and select the date you want. And then you want to click on Add Chart. And this will show you a chart of all the different temperatures for this time period for this patient. Then you can go ahead and click on the arrow again and choose another one. We can do pulse and then hit Add Chart again. And this will bring up another chart, and it shows you all the pulse rates that were documented for this time period. And you can do this for all these different options here. And this gives you a good show of the progress for this patient. Next, we have the 485 tab. And this shows all the 485s that have been created for this patient. To see detail of the 485, you just click on the date, and it will pull up the 485 information in text form. This is not the print format, but it is intended to be a quick glimpse of what text has been entered on the 485 in an easy to read format. So you can just scroll down and look at the information quickly. You can view the print format of the 485 from the Select Patient screen. The next tab is Verbal Orders. And this is very similar to the 485 tab. It displays a list of all the orders that have been put in for this patient. It's just a listing of the orders, but if you click on the order, you can see the full detail of the order in text format. Again, this does not show you the signatures on the order, but it does show you the date that it has been mailed and that has been returned with the doctor's signature. So you can see a history of this order. And if you just go ahead and click anywhere on the screen, it will bring you back to the list of orders. The next tab is the Oasis tab. And you can click to see the detail of the Oasis in the system. And you can scroll down and view all of the Oasis. And this is the same for the Oasis PPS tab. Does the same. Then we have the Care Coordination tab. The Care Coordination tab lists the care coordination notes for this patient. If you click one, it will show the detail of the coordination note, including who created it, the date it was created, the text of the note, and anyone who was copied on this note. And again, just click anywhere on the screen and this will bring you back to the list. The next tab is the Schedule Visit tab. And this shows you a list of all the visits scheduled in the system for a particular patient. It shows the program, the payer, the job code, the visit code, the time in and time out. If the visit has been made, it will show an OK here on the left, and this indicates that the visit has been made, and it will list the actual time in and time out of the visit, along with the amount of hours that the visit took. If the visit has not yet been made, as you can see here, these have not been made. So this is a good way to compare the difference between a scheduled visit and an actual visit made for the patient. All the visits that have been made will have the OK on the left-hand side with the actual time in and time out. The next tab is the 60-day summary. And if you click on the dates listed here, this will show you all the information for the 60-day summary for that date. And again, you just click on the screen and it will bring you back to the list of dates. Next, we have pending orders. Any pending orders, which are orders that have been drafted but not created or sent to a doctor, are listed under the Pending Orders tab. Pending orders need your attention because they have not been sent to the doctor and not finalized in our system. So no one knows that they are in the system except for the clinician that created them. You can also find pending orders from the point of care main screen by clicking the Pending Orders button. It will pull up all the pending orders for you so that you can go ahead and complete them. The next tab is the Office Notes tab. And the Office Notes tab will pull up any notes that have been placed on the patient for nurses who have been visiting the patient. The next tab is Care Conference Notes. And these are notes that have been made during patient meetings. If any are found, they will be listed here for you to view in detail. If there is a discharge plan for the patient, it will be listed here under the Discharge Plan tab. You can just click on the dates to get the details of the discharge plan. And it doesn't look like this patient has any discharge plans, so they're not listed. Any supplies used on the patient will be found under the Supply Used tab. And you can see a list of when the supplies were used and what type of supply it was and the codes. And finally, you have the Messaging Log tab. If you have received or sent any messages in Barnestorm about this patient, you can review them here. This is a good way to look at older messages about this patient without going through all of your messages to find it. On all of the tabs in the patient information area, the information within the tabs can be printed by using the print button found here. You can also copy any of the text that is shown by clicking the copy button. Anything within Barnestorm can be copied and pasted. So let's go back to verbal orders, and I just brought up the verbal order, and now I'm going to click on the copy button and then hit OK. So now I've just copied this information here. So I'm going to go and open up my notepad. And there are 3 options on how you can paste this information into the notepad. If I right click on my mouse and select paste, you can see the information for the verbal order is now in Notepad. I can delete that. You can also go up to Edit and click on Paste. And again, your information comes in. And if you go back to Edit, you see where Paste is. You can also see here is a command, Control V. So I click out of there, and on my keyboard, I click Control V, and now my information is in Notepad. Any text you find in Barnestorm that is within a text window can be copied and pasted. Not just in Barnestorm, but you can also paste it in Notepad, an email, or any place else. So this is a very handy tool to have so you do not have to retype everything over again. Here I'm going to show you how to paste it into an order. I'm going to click on the order button on the main menu, and this brings up my order screen. I can come into the section here where you would type your order, and you can again right click in that space and select paste, and all that information is now here for you to edit the order and make it read what you want it to say, and then you can create the order to send out to the doctors. So you can copy and paste anywhere from Barnestorm. This is a very useful feature to have because you avoid having to retype anything. Our system is geared so that anything that you enter in, you should only have to enter one time. You won't have to retype ICD diagnosis codes or medication changes or information. You shouldn't have to retype any wound, visit, or order information. Those are things that flow throughout the system, and you should not have to retype anything. But in the event that you will need to copy it and use it into another area of the software, you do have the copy paste option anywhere in this software. So now I'm going to close this screen. And for additional instructions on the patient information screen, you can go to your main menu near the bottom and click on the Help button. And then you want to click on Patient Info on the Help screen. And this will give you a list of articles with how-to instructions for the patient information screen. Click on the article you would like to see instructions for. And when you're done reviewing the instructions, you can just right-click on the screen and select the Back button. And this will bring you back to the list. If you don't see the article you want, click on Find More Answers here. And you will see more articles on this topic. If you click on an article here on our knowledge base site, you have options by scrolling down to the bottom of the screen on the right. You can either email the article, print the article, bookmark the article, and you can also export as a PDF, which will save on your computer. And this concludes Barnestorm training for the task of viewing patient information.